One patient cannot breathe lying flat. Another has swollen legs, a full belly, and rapid weight gain. Both may have heart failure, but not the same type. Today, we're breaking down left-sided versus right-sided heart failure in a way that actually sticks. On the left side, fluid backs up into the lungs. On the right side, fluid backs up into the body. Heart failure, left side versus right side, lungs or body. Welcome back to the Nurse Scrub Club, where we make complex nursing topics simple, visual, and memorable. I'm your nurse educator, RN Boateng. In this video, you'll learn the difference between left-sided and right-sided heart failure. What backs up where, the key signs and symptoms, danger zones you should never ignore, and the nursing priorities that matter most. By the end, left side equals where blood backs up, right side equals where blood backs up. Symptoms, danger signs, nursing priorities. Before we talk about failure, let's talk about normal. The right side of the heart receives blood from the body and pumps it to the lungs to pick up oxygen. The left side of the heart receives oxygen-rich blood from the lungs and pumps it out to the rest of the body. Now here's the big idea. When one side of the heart starts failing, blood cannot move forward efficiently, and when blood cannot move forward, it starts to back up. That backup is your clue. If the left side fails, blood backs up into the lungs. If the right side fails, blood backs up into the body. Let's start with left-sided heart failure. This happens when the left ventricle cannot pump blood forward effectively to the body. Instead of moving out, blood backs up into the lungs. That is why left-sided heart failure is often all about breathing problems. Patients may report shortness of breath, especially with activity. As it worsens, they may become short of breath even at rest. They may have orthopnea, meaning they cannot lie flat without feeling breathless. They may suddenly wake up at night gasping for air. This is called paroxysmal nocturnal dyspnea. When you listen to the lungs, you may hear crackles. Oxygen saturation may drop. The patient may look anxious, tired, pale, and exhausted. In more severe cases, fluid floods the lungs, pulmonary edema. So when you think left-sided heart failure, think left side equals lungs. That's the memory trick. Now let's move to right-sided heart failure. This happens when the right ventricle cannot pump blood effectively forward to the lungs. So blood backs up into the venous circulation, the body's return system. That means fluid starts showing up where you can see it. You may notice peripheral edema, especially in the feet, ankles, and lower legs. You may see jugular venous distension or JVD. The abdomen may become enlarged and the patient may complain of fullness or decreased appetite. Some develop hepatomegaly. And here's the sneaky part. Some patients say, I'm gaining weight, but I haven't changed my diet. That weight gain is fluid. So when you think right-sided heart failure, think right side equals body swelling, left side struggles with air, right side swells everywhere. Common causes include hypertension, coronary artery disease, prior myocardial infarction, cardiomyopathy, and valve disease. Right-sided heart failure can also be triggered by pulmonary hypertension or chronic lung disease. And here's an important point. Left-sided heart failure often leads to right-sided heart failure over time. It is not unusual to have both. When caring for a patient with heart failure, your nursing priorities matter a lot. For left-sided heart failure, focus on the lungs and oxygenation. Assess respiratory status and lung sounds. Sit the patient upright. For right-sided heart failure, pay close attention to fluid status. Look for swelling, monitor INOs, and check daily weights. For both types, daily weights are gold, not vibes, not guesses, weights. A rapid increase signals worsening retention. You'll also reinforce low-sodium teaching, monitor fluid restrictions, and administer medications, often diuretics. Now let's talk danger zone, the signs that should make you stop scrolling, stop chatting, and start acting. If your patient has severe shortness of breath, cannot speak in full sentences, or develops pink, frothy sputum, that is not the time for let's just keep an eye on it. That is the time to escalate care immediately. Early recognition prevents collapse. Let's compare two patients. One patient is drowning in fluid in the lungs. The other is retaining fluid in the body. Patient A is a 72-year-old who says, "I can't breathe when I lie down." Crackles in both lungs point toward left-sided heart failure. Now meet patient B. Her shoes don't fit, her legs are swollen, and her neck veins are distended. That presentation points toward right-sided heart failure. Teaching matters. Monitor daily weights, reduce sodium, and report worsening symptoms right away. Fluid is not just bad luck. Left-sided means blood backs up into the lungs. Right-sided means it backs up into the body. Remember, left equals lungs. Right equals rest of body. Thanks for joining us here at the Nurse Scrub Club. Don't forget to like, subscribe, and join us for the next breakdown in nursing made simple. Proceed to the quiz to test your knowledge. Good luck and bye for now.